very good afternoon to all. We'll start our academic session. Today's session is dealing with best clinical documentation practice. The purpose for this academic session is, as a part of Ajara Hospital 5th anniversary, we extend to an open invitation to healthcare heroes everywhere. Elevate your expertise. Our focus is to give an idea about the clinical practice, best clinical practice to all over the hospital community. So that's why we are planning this academic webinar series. This is a second session. Let me begin with Ajara means is everlasting, and it just started operations on 2019 December 8. We have 59 shareholders, and then we have backup of 350 qualified staff. We have a good team for operation. And my name is Mathew Augustine. I am working as a manager, nursing quality and education. Let's begin with what is clinical documentation. If we'll talk about the clinical documentation, it plays an important role in patient care. It's a vital part of patient care, and another importance is it play an important role in legal complaints, and it's a medium of communication. That is one of the important thing. So first we'll see what all are the types of clinical documentation. First one is medical history records. Medical history includes patient data and also include chief complaints and presenting complaints also. These all patient information included in the medical history records. This is one of the type of clinical documentation, and it is a part of patient case sheet also. Next is progress note. Progress note gives a clear idea about patient day-to-day condition from admission to discharge. The progress note, we need to follow a certain format that is called SOAP format. That means S is subjective and O is objective and A is assessment and plan. We will see with the example later on how we can follow this format for the clarity for the progress note. Next important part of clinical documentation is nursing documentation. Nursing documentation include nursing care plan, nursing nurses notes, shift reports, shift handover reports, and medication administration records, that is MAR. This gives a clear picture about the nursing care provided to the patient. Focus on patient observation also. We need to have a plan for patient care. We need to assess the patient condition. All these things we need to document in the nursing documentation. Next type is consultant notes. Every day we know consultant is coming for the rounds and evaluating the patient, and they will order or they will modify the treatment plan. All these come under consultation notes. If consultant is ordering any cross consultation or referrals, that also it will be noticed in the consultation and notes. So it is a clear communication medium between consultant and other healthcare professionals like nurses, physiotherapists, dietitian. All these things, they will get a clear idea about the patient condition and what is the consultant plan of treatment for this particular patient. Diagnostics and laboratory reports. The importance of this one to correlate with the patient signs and symptoms and lab reports and X-ray or radiological reports. The consultant or the treating doctor can correlate the lab result and radiological imaging reports with the patient present condition. They can correlate and they can formulate a better diagnosis and to plan a better treatment plan for this patient. So that is diagnostic and lab reports also very important. Then operative and procedure notes. Operative note, procedure notes, it gives us a clear picture of the patient surgical condition, the pre-surgery, post-surgery, and intraoperatively, what happened to the patient and what diagnosis for this patient. These all come in the documentation with the operative and procedure notes. Next is the important thing is medical administration record or MAR. This is a track down of all healthcare professionals, the medication administered to the patient. The medication administered, what frequency we need to administer that medication, what doses and timings, all these come come in the medication administration record, and who administered the signature, who verified that medication, that signature also all come into the medication administration record. The clear medication administration record, and it helps us to prevent medication errors, missed medication errors such as missed dose, overdose. These medication errors can be prevented by proper documentation in the medication administration record also. Next important document is discharge summary. Once consultant is planning patient to discharge the hospital, so they have a specific discharge plan, and what after discharge, what the patient needs to follow, what all are the medications he or she needs to take, what healthcare modification she need to do. That all information come in the discharge summary. And from admission to discharge, what patient condition improved, or any medication changes, or any health changes happened in the hospital, all these course of patient hospital stay included in the discharge summary. Next is informed consent. Consent is very important. It is a legal value also. Once patient is come into the hospital, we all know they are signing one consent, that is called general consent for treatment, and for the procedure and other high risk consent is their procedure. For patient is going for surgery, there is anesthesia consent. So like that, when many different consent forms are there in the hospitals. So these consents are the patient is giving consent to the treatment doctor or the hospitals that they are willing to do the treatment here or in the hospital. So this consent is, there is a legal value for this consent also. So consent is very important. There is patient signature. If in consent, we need to take the patient signature if the patient is conscious and oriented. If the patient is not conscious and oriented, he cannot able to sign the consent. So we need to go for the next of kin. Next of kin means immediate relative. That is, son. If patient is a father, son can sign. Don't take a signature from distant relatives like uncle, son, or uncle or friends also. We cannot able to take the signature. That is, there is not legal value for that one. Either it is a close relative like close relative, or treatment doctor. If they are not available, the patient is, for example, patient RTA patients, they don't know the address in the beginning. They don't know the address. They don't know who is that patient. Then that time, the treating doctor can give the consent. For the time being, once the patient is identified, and the immediate relative will reach the hospital in case of emergency. So next is the electronic medical records. This is a new recent form of medical records. It is a completely electronic. It's a system-based digital records. So that is, this give us the clear picture when the chance of documentation error is minimizing. So electronic medical records is an important part nowadays in the healthcare system. Most of the hospital is going for the electronic medical records to minimize the paper and to accuracy in the documentation. Then next is the rehabilitation and therapy notes. If patient is getting any occupational therapy, speech therapy, or physical therapy, all these things we need to document in the rehabilitation or therapy notes. Then next type of documentation is psychological and behavior notes. It includes the patient mental assessment. If patient is having any patient, we need to assess the patient's mental health status in this behavioral and psychological assessment sheet. Then next is advanced directive and legal documents. This record the patient preference regarding the life sustaining treatments and power of attorney. If patient is giving power of attorney to the hospital for the treatment. Then Next, we'll move on the timelines. Time is very important in the clinical documentation. Accurate and timely documentation, it is very important. If we are not rely on these timings, we may miss some documentation. So documentation, time time is very important in the clinical documentation. And we need to follow the institutional policies and procedure for the documentation. For example, if we forget to document at the time for the busy schedule, or we have 4 or 5 patients to take care, all having some procedures, we are busy in the wards, so we forget or we missed one documentation, and then immediate, for example, if nurses is have a busy schedule, they have no, maybe they are handling more than 4 or 5 patients, there is, maybe they didn't get the time for the accurate, also timely documentation. But that we need to take a small notes, and remember, we cannot able to remember all these things for this 4 or 5 patients events. So we need to take a small notes. That is one of the tip to follow the real timings. And another tip, if we forget and we went after the shift, we went to home, we remember something, next day what we need to do, we can come and then we can document it with the date, time, and mention with one note late entry notes. So that also we can practice. Then legibility and format. All our clinical documentation with legible, it should be readable, it has a clarity, it should have a clarity, maintain the clarity, ensuring handwriting, it should, even it's a legible means all can read, and the information should be communicated to other healthcare professionals. That is the main important thing in the clarity and legibility. In here here it will come the electronic medical record. There, if we can rectify these things, if we have electronic medical records, there is no chance for the mismatching handwriting. We cannot able to do it. That kind of things we can minimize with the electronic medical records. So we need to, the same as we talked before also, we need to follow that SOAP format, subjective, objective, and assessment plan. And for the communication, we need to follow SBAR method, situation, background, and assessment and recommendation method. This is the effective tool for the communication between the healthcare professionals. This is a healthcare professional tool for the communication for the shift change or patient transfer from one unit to another unit, one area to another area. This is the main communication tool for the healthcare professional, that is called ISBAR. And we need all this documentation, all the content should be organized organized with the headings, bullet points. And this is the example for SOAP format. This subject is 16-year-old male, non-history of type 2 diabetes mellitus, hypertension, and chronic liver disease with ethanol induced on tablet Telma and Zorel M since 2 years. Chronic ethanolic, last intake was 2 days back. History of 2 units of blood transfusion 2 years ago. Presented with 2 episodes of massive hematemesis followed by severe abdominal pain and dizziness since today morning. No history of fever, loss of consciousness, loose stool, and seizures. This is the clear subjective data. Everything as related to that particular patient, everything is mentioned. It is mentioned past history, present history, and past blood transfusion history. All history come patient present and past history according to patient. There is subjective, demographic data also came. Patient is 60-year-old. We cannot able to tell the patient name in the webinar. That's what not included. All the demographic data came into that subject. So next is object. On examination, what we observe, it will come into the objective data. On examination, patient is oriented and peripheral pulse. We can palpate the peripheral pulse, heart rate. We need to record the vitals, saturation, and all the assessment is come in the objective data. Next is going for the assessment. According to this objective data, we are making certain assessment. We need to check the GCS. We need to rock call scoring. Rock call scoring is the if the patient has a chance to get a rebleed. There is a tool for the healthcare professionals to assess the rebleeding risk and mortality risk. Rebleeding and mortality risk. It's a rock call scoring system. And according to this scoring system, pain assessment and fall risk assessment, all these are come under assessment category. This also is a part of documentation. We are following in format of SOAP format. Then plan. According to this, our subjective data, objective and assessment, we need to plan of care or plan of treatment. Then order for blood investigation. For example, if patient is fever last 4 or 5 days, we need to go for the blood culture. And according to this data, we are formulating the treatment plan. Why the documentation is important and what is the legal values for this documentation. So this is a protection for healthcare professionals. Legal protection. If we document it in a proper way, if somebody challenge in the court, we have a proof. We have a proof. We already given this care. We have a documentation. We have a proper documentation. This is the protection for healthcare professional, and we need to follow the NABH standard if the hospital is accredited by NABH, and we need to maintain the confidentiality. That is very important. Not supposed to spread the patient information to other people. This to maintain some confidentiality and obtain informed consent for the documentation. If any procedure or treatment, we need to have the informed consent. Then consistency for this clinical documentation. This we need to use a standard template. All the hospital need to have the standard template according to the hospital policy and the SOPs what we are following. So we need to develop a uniform template for documentation for all over the hospital, including ICU, including the wards. All over the hospital, we need to develop a standard and uniform template for the documentation. And regularly, we need to check our SOPs and update the SOPs, and we need to go for the current practices, try to include in the SOP, so that all will help to improve our quality of care and accuracy in the documentation. So we need to have the continuity, ensure the continuity. Documentation should continuous. There is no gap in the documentation. There is no conflicts come into play in the documentation. All this we need to make sure for the better documentation. Then error management. If we made any error in the documentation, we need to correct it. Once we identified this is an error. So this correction will help us to minimize the error in the documentation. We need to identify the errors and correct it. So that's what many patient case record is going for. Many steps of checking. For example, checking by auditors or checking clinical auditings is happening. These process help us to minimize the errors. If any errors is there, we need to correct it at the timely basis. Next is patient-centric approach. For the clinical documentation, one is the important point is patient-centric approach. Include patient input also. We try to include patient complaints, patient concerns, and preference, and these all are the things also we try to include. This is depends upon the hospital policy and procedure. Emphasize the patient education. That is very important for the NABH. We need to include patient and family education. That is one of the part of documentation that must be included in our case records. That is a part of NABH. It's an NABH standard also. We need to take the signature from the patient or patient attender. So we given a proper education to the patient. That is one of the NABH standard also. And collaboration and communication in the clinical documentation, we need to have a multidisciplinary input. Includes contributions from. It is a combined effort. we have better documentation. All the departments, including doctors, nurses, and other healthcare professionals, we need to have a multidisciplinary input. All needs to document in a timely accuracy and in a legibility. All the department needs to follow all these rules. Then the documentation is accurate and we can practice the better clinical documentation. And if the technology is advancing, we need to be, if there is hospital is providing electronic medical records, this is better updation in the healthcare system. If we can minimize the errors with the electronic medical records. And if we are using electronic medical records, we need to make sure that our data is security, that IT professional will take care of that data security. So security is very important. Data security is very important if we are using electronic medical records. Then for the documentation, this regular training of the staff to conduct periodic training, audits, and according to the audits, you need to formulate a better training plan. As per this training plan, you need to prepare your training schedule, and you need to plan for the class or training for the staff for the better documentation practices. And auditing, planning, training, it is a continuous process. There is no end. So recent updates and auditing it will continue all over the hospital, and this will help us to identify the gaps and to improve the system. And common pitfalls to avoid. What all are the common pitfalls come in the documentation? Incomplete documentation. That is a common. We are leaving some gaps in the patient records. It is a wrong practice. Don't leave any gaps. So that consider as incomplete documentation. It will affect the continuity of documentation. And copy pasting errors. If you are using electronic medical records, we are trying to copy paste from other patient to this patient, with same diagnosis. That also it leads to some errors. And use of unapproved abbreviations. We are doing many audits, and many times I noticed instead of patient, many people is writing PT, and for the treatment they write RX. That abbreviations we need. If you don't know this abbreviation is not approved or not approved, better don't use it. If you need to know what all are the approved abbreviations in your hospital or in any hospitals, you need to go for your SOP or manual. There is a clear instruction. These all are the approved abbreviations. You can use it. Don't use unapproved abbreviations. That will lead to documentation error. And what is the benefits to adopting best practice? Why it is important? Why needs to adopt the best practice? It leads to better patient safety, and patient safety is important. So accurate and timely documentation reduce the errors. It leads to patient safety, and we need to go for better standards in patient safety. Enhanced communication. So all the clinical documentation is a medium of communication. So our communication is proper. There is no gap in the communication. We need to maintain there is no gap in the communication. We have better documentation system. So documentation is important to enhancing the communication. And we already discussed it will get legal protection for healthcare professionals, and it is getting regulatory compliances and efficient reimbursement. All these are the important points. And some take-home points: documentation, real-time documentation is important. Accurate and clear documentation, and it should be an organized pattern, and use updates regularly, and ensure compliance, and use technology wisely. Collaborate effectively, handle errors transparently, focus on patient, and keep learning. And I'm concluding my topic. Best practice in clinical documentation leads to better patient care, and it leads to it improve the total quality of patient care and healthcare system. Thank you. Well documented care, well deserved thanks. Thank you everyone for joining with me.